Asma Begum, and I am the founder of Soul Sisters Empowering People. And the charity Soul Sisters Empowering People supports anyone that's been affected by domestic abuse. And what we want is people to be able to live a life without fear. And one of the things that we want to do is raise awareness of mental health, the effects that a victim or a survivor of or a person who suffers domestic abuse can suffer afterwards, is mental health issues, things like we have talked last week about schizophrenia, bipolar associated disorder. Now, another big one is post-traumatic stress disorder, PTSD. And this is something that Dr. Shakoor will explain more about. And he will first of all introduce himself and tell you a little bit about his background. And then he will explain about this disorder. But it's really important for our charity that we raise awareness and educate people that domestic abuse doesn't just happen to a victim and that's it. They actually suffer during the time that they're going through abuse and afterwards, and it can be a long-term effect. Over to you, Dr. Shakoor.
Yeah, okay. Right, okay. My name is Abdul Shakoor, and I work as a community engagement link for people with dementia, learning disabilities, and mental health therapist. This is my role, which I do in my job. Today, we are talking about PTSD, a post-traumatic stress disorder. And its overview is like, it's a PTSD is an anxiety disorder caused by very stressful, frightening, or distressing events. Like you may develop post PTSD if you have an experience or experiences that you find traumatic. Now, the development of this PTSD depends on different factors. These can include things such as any history of mental illness, the severe and type of trauma you may have gone. Uh, uh, Basically, what I'm doing is because I didn't have these slides in hand before, so my lecture which I prepared may not go, but any slides you will see, I will cover everything in my talk. Let's see, it says causes of the post. What are the causes? So let's first we go through the slides which are here, and then we will see how it goes. You can have this PTSD after experiencing something that you find traumatic. And this can include seeing or hearing about something traumatic. It can also caused by experiencing, witnessing, or hearing about single, repeated, or multiple events. Now, what these events now causes? Serious accidents is number one, emotional abuse, race-based trauma, physical and sexual assault or abuse, including childhood or domestic abuse, work-related exposure to trauma, such as being in an army, emergency services, or humanitarian sector, trauma related to serious health problem or childbirth, war and conflicts, and torture. These are the main causes of PTSD. Now, but it could be caused by other things as well. The important thing is how you individually experience the event or events. So it depends, like in different situations, in different circumstances. Traumatic events might affect our belief that life is fair, reasonable, safe, and that we are secure. But not everyone who experiences trauma will develop PTSD. That's the most important thing, that everyone who will experience trauma not necessarily will develop PTSD. The risk of PTSD depends on how the experience affects you. So it affects different people in a different way. Next slide.
Dr. Shakoor, the next one is symptoms of post-traumatic stress.
Symptoms. Okay, we will go on symptoms as well. In post-stress disorder, actually it's a mental illness. So obviously the symptoms will be kind of which we have in mental illness. So when we know, if we know the causes, now one thing I will add, the risk of PTSD depends on how it affects you, like is unexpected or goes on for a long time or involves being trapped or is caused by people, causes many deaths. So all these things. Now, depression and anxiety disorder, these are the two main things which we have to develop. And what things, before we go on symptoms, what things might help protect you from PTSD? Connecting with others such as family and friends, receiving empathy and understanding from others, helping others like doing some volunteer work or the work like Asma is doing. These kind of work, if you engage yourself, then less chances are. The main symptoms and behaviors associated with this are reliving the experience through flashbacks, intrusive memories. Some people have nightmares. Some people will feel that they have got like kind of overwhelming emotions with the flashbacks, memories, and nightmares. And or some people feel that they're not being able to feel emotions or feeling means numbness, disassociation. That can include disconnecting from yourself or other people. Avoidance is another symptoms, like this could mean that uh, you try to distract yourself from thinking about the trauma, or you avoid people and situations that remind you of the trauma. Other symptoms, there are some other symptoms are negative mood and thinking, difficulty. Some people find it really difficult to controlling their emotions. Some people are irritable, panic, constant anxiety. They feel really, really angry. Also, uh, it is hard for them to feel pleasure. And when I was working with people with this condition, I found some people, those mainly they were asylum seekers, which I was working with them 2 years ago. And I found that some of them have really heavy sense of guilt or shame as well, and negative self perception, such as feeling diminished, worthless, or defeated. They also have problems in relationship and feeling detached from people. They will also have like problems with sleeping and concentrating because of being in a state of uh, this kind of severe anxiety. Uh, they being easily scared, and self-destructive behavior such as fast driving or drinking too much alcohol. So all these kind of symptoms are associated with uh, this condition PTSD. Next slide. Causes. Causes which I think I just explained the causes that people, if they have seen something uh, traumatic, or they have been through something, or they have heard something uh, which they cannot, which is coming in their flashback. So all these things are the causes of PTSD. Complex post-traumatic stress disorder is that complex one is still uh, more or less the same, which we say that complex. But complex means that sometimes when people are going through this, they cannot understand what exactly they are going through. And sometimes it takes really time for practitioners or health professionals to diagnose. So maybe from GP, they are going to uh, psychiatrist, consultant, but at the same time, they go for other therapies which are available or self-help available. So it's active monitoring I found when it comes to complex post traumatic stress disorder, active monitoring or watchful waiting suggested to in these kind of things when uh, if it's not a complex one, but it's just like a mild symptoms. But when it comes to complex one, then they really have to go through psychiatry or high therapy like CBT is helpful. Next slide. When to get medical advice? Firstly, when you have, if you feel that you have all the symptoms which I was talking, if you feel that you have some of those symptoms, and you have noticed something, maybe like suppose you were walking on the street and you saw a very horrible accident, and or maybe you have seen that a person was dying in front of you, and obviously that will affect your uh, mental health, your behavior, your thinking pattern. And then you, if you think after a few weeks or few days you have developed some symptoms, then you should go to your GPs. The first contact is your GP, and then you should get medical advice, and then GP can refer you depending on your symptoms. The treatments are, there are various treatments for PTSD. You may respond to a trauma focused therapies if you have complex PTSD, which the slide was before. Now there is some overlap of symptoms between complex PTSD and borderline, which is called borderline personality disorder, BDP. If you have complex one, then you may benefit from certain treatments that help people with BPD, which is a border personality disorder. And border personality disorder, uh, then if you have complex needs like complex PTSD or drug or alcohol issues, then you should be excluded from treatment, because if you have a drug or alcohol issue, if you have complex PTSD or a drug or alcohol issue, your health professional should give you more therapy sessions or give you a longer therapy sessions to help build the trust. Now you have to think about the impact of that your personal circumstances will have on the outcome of therapy. For example, your housing situation, or help you to manage any issues that might stop you from being able to engage with trauma focused therapies such as substance misuse. So ideally, like when people come to me for counseling or active monitoring therapy, mental health therapy, we have to make sure that person is not on heavy antidepressants. Because if somebody is under all these medications, then sometimes these therapeutic sessions don't work. So people, they avoid. And in these days, I think doctors are doing things like, if certain antidepressants, which can make you really fresh and awake, then they ask you to take it in the morning rather than in the evening. So there are different types of treatments, and the first contact will be your GP, and then he will refer to you. Right, in the slide, I'm sorry, my eyesight is weak, so I'm just trying to read the slide. If you feel intense, please.
Would you like me to read it, Dr. Shakoor?
No, no, it's okay. I can manage now. It's minus 19 and my retina is detached. Can you imagine?
You're
So,
doing really well. You're doing really well.
yeah, right. Okay. What is saying that when it triggered self-help kind of thing, this slide is saying how you can do, it's a self-help guided therapy, in other words. So breathing exercise is really good. And that exercise is good even if there is an anxiety attack or panic attack. So breathing exercise is really, really helpful. Plus uh, medications from GP, muscle relaxation exercise, listening to soothing music, or getting in touch with nature. Ideally, kind of a 5 ways of well-being, and out of which it's one, mindfulness. That if you feel that PTSD is triggered, the first thing, you have to do something yourself, and then go. Appointment with GP is not easy. It takes sometimes 1 day, 2 day, 3, 4 days. So all these things, if we do, like going into the park, walk, enjoying the nature, and just uh, concentration, like mindfulness. If we are eating, then we are eating, not on the telephone or on the television watching anything. We have to enjoy every bit. Like if we are drinking, then I have to feel I'm drinking water and I feel my water in my throat.
So
So it's
Dr.
like
Shakoor,
mindfulness.
so
Yeah,
what you mean is really focus on what you're doing. So if you're
yeah,
eating, focus on that, like feel the taste of it, smell the food. Don't, because a lot of nowadays people are on their mobile or watching TV while eating. They don't even realize they've finished their food or they just ate that, or drank tea. So what Dr. Shakuri is saying is being in the moment and just not letting distractions come in the way and like just
yeah,
enjoy that cup of tea, isn't it, Dr.
yeah, of
Shakur?
course. Yes, of course. It's like mindfulness. So if we have that, will increase our concentration power. That will um, give us a like kind of support towards our this PTSD triggers or anxiety issues, even depression issues. So these are the things. And healthy eating. We have to eat healthy food, no junk food, and obviously smoking and all these things. Person should avoid as much as he can or she can.
I guess it's also about using your five senses when you're triggered,
Yeah. Yes.
basically, isn't it? Here, so even like a cup of tea, if you really put it near your ear, then you'll be able to hear some sort of noise. If you smell it with your nose, if you taste it with your
Yeah.
mouth, if you look at it with your eyes and see, because everyone's tea, people like it different colors. And the fifth one, obviously, touching wise, I guess touching your mug,
Yeah.
isn't it, Dr. Shakur?
Oh yeah. Of course. Now also I mean, you are right, Asma. Uh, there are things people can do to help themselves, and this is also known as self care or self help. But uh, everyone is different. I can understand that everyone is different, and this is the slide. How do you calm? You can learn how to notice when you are becoming unwell, and know that what your triggers are. Uh, so if you know your triggers, so you can find out in a way that uh, worried about your mental health. There are some fact sheets are available, which I will send to Asma, that can tell you. So to calm yourself, as it says in the slide, 5 ways of coping with PTSD is learn about trauma, yeah, awareness, then just support group. There are support groups in each town, I'm sure. I think Mind might have some support groups, and also relaxation techniques, uh, outdoor activities, enjoying some sports and other things. Spend time with the positive people, avoid alcohol and drugs, and the enjoy the nature. So these are the things. I
Dr.
think
Shakur. The other
I'm
one
just put,
is the other one is
yeah,
confide in a person that you trust as well. The other one is.
yeah. Oh yes, I'm just putting the charger in my computer. I think it's, yeah. Just 1 second, Asma. I'm just putting the charger. I think I don't know.
That's
Something
absolutely
happened.
fine. That's absolutely
Yeah,
fine.
it's just this one is happened, but I will just see if I can put the charger.
I think
And
it's just with triggers, I think a good one as well that I talk about is having some sort of journal, whether it's an audio journal on your phone or actually a physical journal that you can write in. Now, it's good to have a
yeah,
physical one that you can write
yeah.
in because they say that writing with your hand on a piece of paper is very therapeutic. Um,
Oh
and what that
yes,
and what that means is when you're writing, like trying to work out what the triggers are, how you feel at that time will help get it out of your mind, put it onto a piece of
yeah,
paper, but also you will be able to read back to yourself what it is that triggers you.
yeah,
Now, for example, when someone's gone through domestic abuse, the triggers of PTSD can be the name of that person, the smell of that person, a music, a song that you might have basically attach it to the person that was the perpetrator. It could be things like a location. So you will see some victims won't stay in the same location as the perpetrator because it triggers them. It could be the name of that person. It could
Yeah,
be, one of the things could be if they used to abuse you in the kitchen. So if you then have left that person, or and you're in your own kitchen, you may get triggered because things will come back to you about what that person used to say to you, and it may make that person's the victim stop going to the kitchen and doing housework or any cooking, because when you're triggered, the body is so, it freezes, and all it wants to do is just avoid, like Dr. Shakoor said.
yeah. Also, when we were talking about symptoms and like PTSD and complex PTSD, symptoms are same in both conditions. It's just when it comes to complex means people might have some extra symptoms. So that's why it's called complex. Otherwise, there isn't anything else different. Like, for example, relationship issues, or connecting with other people, or belief that you are worthless, feeling of shame, guilt. If there are some kind of extra symptoms, then it's called complex PTSD. Any questions so far, Asma, from anybody?
So there are questions. What we will do, Dr. Shakoor, is we will stop recording. Maybe
Oh, okay.
I might try to ask some during the recording, and I won't name anyone, but I'm putting my details on here so that if anyone wants to, and I know that in the last few sessions, people wanted to have a one-to-one with Dr. Shakoor, so they can do that through me. Dr. Shakoor is happy to do that, and we can have a Zoom, isn't it, Dr. Shakoor? So
Yeah,
please
sure.
take, if you haven't got my details already, and Dr. Shukuri is always happy, and he's brilliant like that. He'll have a one-to-one with you and help you and talk to you, even if you're not in the Rochdale borough.
Yeah,
Um,
anywhere.
so I'm going to look at some questions that we have and see if we can answer while we are recording, and then we'll stop recording in a moment. Let me just have a look. I'll go through them and see. So we have one here. Can you ask Dr. Shakur to elaborate on EMDR, the therapy EMDR?
EMDR is eye movement desensitizations of repressing. So very kind of wordings and pronunciations. But it's like eye movement desensitization and reprocessing. Basically, it is a comprehensive psychotherapy that helps you process and recover from past experiences that are affecting your mental health and well-being. Now, it involves using side-to-side eye movements combined with talk therapy in specific and structured format. So, this is something called, and it's there are different types as well, and different ways of working. You need extra session. If you want, I can go through that. EMDR.
And what is CBT?
It's cognitive behavior therapy, CBT, and that is available in Rochdale, every town, I think, where IAPT services are through NHS. So it's a kind of a therapy. It's like there are different therapies like psychotherapy, group therapy, counseling, active monitoring, self-help, guided therapy. So CBT, which is cognitive behavior therapy. There are certain issues with CBT. When it comes to CBT, some people from South Asian background or Afro-Caribbean or African people may find that it's not culturally appropriate. Few things in that. Uh, but otherwise, it's a recognized therapy and it's everywhere in England.
Thank you very much, Dr. Shakur. So we will stop the recording here, and then people can ask you some more questions or maybe share their lived experience. This has been a really useful session. I am going to put a feedback form on the chat box. Please do fill it out and give us feedback on how the session, how you found it. And Dr. Shakoor, we're really grateful for you to talk about this. And obviously you can find out more about this on the NHS website. Also, yeah.
Yeah, sure. Any question?
Yeah, the other thing I wanted to ask is how can sometimes people, it's the trust issue as well of going, and how do they trust that they can go and speak to a doctor? And because PTSD isn't something that is straight away diagnosed.
No, it takes time.
It can take a while. Why is that?
You see, the things are, like mental health conditions. When we talk about, say, bipolar or schizophrenia, PTSD, anxiety, it all happens when therapist or GP asks you questions. It's not a scan, ultrasound, or blood test. So it's different with other illnesses like diabetes. Okay, I have a diabetes. Okay, let's go and have a blood test. Yes, you have, or you don't, or you are on borderline. It's not like that with mental health sometimes, most of the time. So for example, doctor is talking to a patient. Patient says, I'm depressed. Okay, what is happening? Then doctor will ask certain questions, and then he will say, how do you feel in the morning, in the evening? Do you feel depressed all the time? Do you feel hopeless? Sometimes, every day, twice a week? Do you feel suicidal? Yes or no? So all these questions. Even after that, he cannot say that person has got bipolar or not. That is why when it comes to bipolar or other these kind of things, a psychiatrist, a consultant will diagnose. GP will refer. GP can give certain medication and see how it goes. For example, person is gone first time, so GP will give him antidepressant, or if he's got some allergy, other anti-allergy medicine or anything else, then come here after 4 weeks. Then he will call him, then go again through, things are improving, no, then okay, I'll refer you to the consultant, and then consultant will diagnose. So that is why, what was your question? Sorry. Trust. No.
Why does it take a long time for a doctor
No, yeah,
to diagnose?
that is why it takes long time.
Thank you. And just before we finish, do you have any services that you can suggest in Rochdale that can help with this?
Mind can help, and through GP, talking therapies, thinking ahead.
Definitely. Okay, and if you're not in the Rochdale borough, then definitely you should be able to find on the website NHS or your local, if you look for
Local council,
support,
local
local
council website.
council.
Yeah. People have to remember just this one thing, that PTSD is that torture, slavery, long period of domestic abuse, or long period of sexual or physical abuse as a child or adult. These are the main categories. And when somebody, suppose if I go to the GP and I say, look, doctor, I am feeling that I've got PTSD. So these are the 4 things he will find out first from me. And then if it's all those 4 things are not there, then he will ask other questions. Have you seen something? Have somebody died and you were there and you had this kind of shock? Or have you seen an accident? Then he will ask other things. Or have you heard somebody told you about something? Somebody has spoken to you about his childhood abuse experience or something? Then it goes like this.
That's perfect, Dr. Shakoor. You've actually mentioned the last thing I was going to say. Yes, so if it's one of those things, then the doctor will main things that the doctor will try to work out. Because for example, if I shared my domestic abuse story to a friend, that person could get traumatized by listening to that, and that could affect them. and they could suffer post-traumatic stress disorder. So just to be mindful of triggering people as well as yourself and having
Yeah,
conversations about your situation. A lot of the things I see within the charity is people will discuss things with their family quite a lot and they'll get upset because the family's not
yeah,
listening. But
yeah,
sometimes it's hard, it's easy for me to say, but the family member or the friend might not be able to help you because if they've not been through it, but also they might actually be finding it hard listening to you telling them, and they might be suffering as well. So that's what Dr. Shakur is saying.
yeah,
So yeah, go on,
yeah,
Dr. Shakur.
yeah. You are right, because you see, uh, when we hear things, it makes some changes in our body. Our body chemistry changes. So it's not I have to see something, then I will have this PTSD. If I have heard something, still I can be affected with and have PTSD. You see, like suppose uh, when I don't know about the culture has changed now. Like I'm talking about when I was young, like 20 years old, and that I'm talking about 50 years ago when I was 20. I'm 70 now. So at that time in villages, if in the family or somewhere, if the young girl is there, and if somebody says, oh, now it's time for her to get married and she will have this dress, and all of a sudden the girl face was gone red, you see. Now nobody has touched her, nobody has done anything, it's just something which she heard, and that changed her chemistry of her body. Or people those who go are going somewhere very quiet, maybe in cemetery or somewhere quiet in night time, and they are scared, and the color of the face goes pale. So when suppose if you are sitting in your in cafe, and somebody comes and starts shouting or saying some bad words and swearing, obviously your face will change. He hasn't touched you or does any physical harm, but because whatever you hear, that affects in the body, that makes effects. That's why uh, these faith based work when I do. So if I'm working with Hindu faith or Muslim faith, Christianity, I say that make some arrangements where you can listen your religious text either on YouTube or with headphone or something, and it will make you kind of give you some kind of a peace, and it works. So words which are going. So if I am hearing a story from somebody, what happened maybe in Iraq or Syria or Iran, and he's saying that in front of my eyes my family was killed. Now when I hear that, and then it comes, I have a family, and suppose if this was happened with me, how will I feel? So his story is affecting me as well, and that's how. So it's not just you have to experience yourself, you can hear something and it can affect you as well. Everything and anything you hear, it affects.
And this is brilliant, Dr. Shakur, what you said about the chemistry in your body changes when you're triggered, when
Yeah,
something, traumatic has happened. So, as a child, there's a lot of adults that unfortunately have been abused as a child, but they block it out. And then in adulthood, sometimes they remember that situation because of something like a name or a picture they've seen, and their body reacts in that way that Dr. Shakur said, the chemical reaction in your face, in your body, and that's a trigger, that's the symptom, you can
yeah,
see in a person. So
yeah.
I think for tonight, I think I'm
And
going to, yeah, go on.
and yeah, and asthma, there is no any scientific research which I'm saying now. There is no any evidence or anything. It's just my experience and meeting older peoples like gurus and all these in different places. If you are standing, then chemistry of the body is changing fast. If you are sitting and listening something, it will affect less. And if you are lying down, then it will affect more less. So that is why it says that if you are somewhere and something is making you angry, and you think anger is coming, and if you are standing, sit down. And if you are sitting down, lie down. And if you can't lie down, leave the room. And that will help you not to get angry. So these are certain things. There is no scientific evidence, or it's not written anywhere. It's just my experience of meeting, because I've been to lots of ashrams and gurus. You people might have heard called Rajneesh, which is called Osho as well, and Maharishi Mahesh Yogi and all other Sufi saints in India. So that's where when I talk to them, I just listen what they say, and then I got loads of things around. Like it comes like a spirituality, in other words.
And that's really good to know. And I guess with these self-help things that we are talking about and therapies, and what Dr. Shakoor said is absolutely correct about this thing about if you're sitting, stand up. But you know what? You have to practice it every day,
Yeah.
even in your good days, so that when you
Yes.
are, so what happens
Yeah.
is, if you keep doing something and it becomes a habit, then what happens
Yeah.
is when you are triggered, your body would automatically use that technique and it
Yeah.
will bring you out of that situation. But it takes you have to practice it even in your good days,
Practice. Yeah.
not just your
Yeah.
bad days.
Of course. And stand, if you are standing, sit down, or sitting down, lie down. It's a hadith as well. A Prophet Sallallahu Alaihi Wasallam. It's a if for Muslims they should know, it's a hadith from Prophet Muhammad Sallallahu Alaihi Wasallam as well.
That's brilliant, Dr. Shakur. You've given us so much information. So what I'm going to do here is I'm going to stop the recording, and then everyone that's here that can speak to you. Thank you very much. This has been a really important information session. It will be shared on YouTube. So do share with anyone that you know, because you just don't know who you might be helping out there. And I
Yeah.
will.
Yeah.
Um,
And have some relaxation exercise. Go to the park. Sometimes, it's not, I'm not saying to everybody that you do, but what I do, sometimes I go to the park, and what I feel that there are two trees side by side, and they are talking with each other. Trees talk with each other. We don't know. All these birds, and when they are making some noise, they are talking maybe, but we just don't understand their language. They may not understand our language.
It's
So
interesting you say that because we have a book club. I will get the name from you in a moment from the person that runs it. I don't want to say it while it's recording, but in there it talks about this thing about being mindful and being in the nature and actually watching the trees because they are talking. Yeah, let me stop recording. Thank you very much, everyone, and thank you for listening. And please give us some feedback. Take care, everyone.